Hello, my global friends. COVID-19 is a pandemic. With the advent of COVID-19 vaccines, herd immunity is taking shape. People who work in healthcare facilities have some common questions about non-pharmaceutical control after vaccination, such as, should I wear a mask when I work in a healthcare facility after COVID-19 vaccination? I'm going to discuss it in a plain language in the context of herd immunity. Let's see what happened during first 2 weeks after vaccination. That is a primary immune response, so-called innate non-specific defense. So we are vaccinated with the COVID-19 vaccine and our bodies respond to it with the IgM production, which is our primary defense and also is very weak. But our bodies are preparing IgG and IgA and also T cells for remembering the pathogen during this period of 2 weeks. Which takes time, mostly 1 or 2 weeks, or sometimes 3 weeks. In the case of COVID-19, 2 weeks for antibodies and 3 weeks for T cells. And then secondary response follows. This is when SARS-CoV-2 infects our body and our immune memory wakes up, ready for clearing the virus. And this is a stronger response, specific, so-called adaptive immunity. Actually, vaccine induces adaptive immunity that have two types. One is called a humoral response, including antibody responses, such as IgG here, IgG that is in the blood, and IgA on the local organs, such as respiratory tract, for example. And second type of immunity is called cellular immunity, including T cell response. We're talking about two types of T cells, CD8 and CD4 T cells. Actually, CD8 T cells eliminate viruses. The next question I'm going to ask, can we be infected after vaccination? The answer is yes, based on the research on measles vaccination. It's possible, and as the case is reported, then in a primary response of our vaccination, if we are infected with COVID-19, the nucleic acid testing will show the evidence will occasionally come positive. During secondary response of a vaccine-induced protective immunity, there may be inapparent reinfections, or so-called inapparent, clinically it's called an asymptomatic infection with no symptoms. And nucleic acid testing may show the evidence. Occasionally come positive. And lastly, the immune memory during this period of time, we're talking about here, this is a secondary response. Start from 2 or 3 weeks for COVID-19. IgG, IgM started, IgA and IgG started 2 weeks, and T cell response started 3 weeks, third week. And immune memories after follow the third week and 4 weeks and forever. It can be a few months or a few years. Then the still mild inapparent reinfection happen. Nucleic acid testing may come positive, that showing evidence. And immune memory may win over time, and the virus may mutate. The virus may come back. Okay, here is another thing we're going to talk about: the immune response and the nucleic acid testing after vaccination. As shown in the summary, I drew the table to show 3 indications of nucleic acid testing results. Can be positive or negative. IgM and IgG, positive and negative. This is just quality results. Say in 6 different examples. Let's see. Number 1, triple negative, which means no infection, no vaccination, because there's no immune memory. So IgG is an antibody of a memory. This is an indication of immune memory. And T cells, of course, also another memory, because technically T cell analysis is quite expensive. It's not feasible in the most hospitals. So we take IgG as example to indicate immune memory. And second, you have nuclear testing, so no virus, no IgM, only IgG, which this is an indication of a secondary response of a vaccine-induced protective immunity taking place at least 4 weeks after vaccination, which is shown here, 4 weeks over here, and where IgG level is high, goes up, but IgM level waning or waning all the time. And then there's no infection because we are protected in this period. Now let's see the third example where there's no virus, but IgM and IgG both positive. This situation will be like the third week after vaccination, And what happened here is during the third week after vaccination, we still have some level of IgM and some IgG, you can see here. And then because this is in a protective immunity and our body under protection, and so there's no nucleic acid. And in the another situation I want to say here is either our protective immunity can be induced by vaccination artificially or through infection naturally. Okay, that means we infected somehow with COVID-19 and we recovered 4 weeks after and also third week after, and they're going to show same or very similar pattern of IgG production and T cell production and also IgM. And let's see the number 4, triple positive. Triple positive meaning there's a virus and IgM shown here and IgG. So that most likely this is a situation of 2 weeks after vaccination, or we have mild infection that lasts for 2 weeks over here, and can be either of these. And number five, there's a virus, there's IgM, but no IgG. No IgG, meaning there's no immune memory, meaning there's no vaccination. No vaccination, which means the infection probably ongoing in the first week where IgG is in progress, in process coming, in the later weeks. The last one, there's a virus, but no IgM, no IgG, which means no immune response. When there's no immune response, this probably represent a situation of immunocompromised conditions or immunosuppressive conditions. Our body cannot produce any immune response. And positive meaning we are infected. And this is a very, very dangerous situation, which can be life-threatening after this. Okay, now I'm going to summarize what we learned today. I'm going to share what we shared today, and also you're learning, and I'm also learning. I wish I can get your comments so that improve my quality of a video for education purpose. So let's summarize what I have here. So most people after vaccination will develop protective immunity against COVID-19 eventually, as mild inapparent reinfections still happen. Non-pharmaceutical control should be carried out, like wearing masks, here, and washing hands, keeping social distance, taking nutrients like vitamin D, and calcium. Those deficiencies have been found to be associated with high death rate of COVID-19, right? Take this every day. It will help improve our general health, our immunity. If you work in the healthcare facilities and you need to keep these control to protect people who cannot be vaccinated, those new babies, newborns, immunocompromised patients we talked about before. So protect them. And say we put a mask on this positive case, and you are vaccinated, you still need wear masks, right? When you work in healthcare facilities. So let's go back to the herd immunity story. Go back in the equation and put everything together. Say if by wearing masks or keep a social distance of those non-pharmaceutical control, we can reduce the transmission rate by 43%, PC transmission rate, and vaccination rate increased to 43%. If R03, the COVID-19 virus is reproduction number is 3, then the R is less than 1, which means in the community, one single case cannot spread to more than one person. So that disease spreading is stopped. Pandemic will be over in the community. But everybody, we should wear masks after vaccination. And this is references where I took information to make the video, and your comments are extremely appreciated. That will help me improve my quality of the video. Thank you for your attention.